Hi, I'm Angela Leung from the School of Nursing, the Hong Kong Polytechnic University. I'm the Deputy Director of the WHO Collaborating Center for Community Health Services. It is my great honor to share the project with you. The project is the Blended Gaming COVID-19 Training System, in short, we call it BGCTS, and this is made by WHO guidelines for the staff in residential care homes. I will talk about the development and its pilot testing. Other than me, we have Director for the WHO Collaborating Center, Professor Alex Moriciotis in the team. And we also have experts from Center for Gerontological Nursing, like Dr. Daphne Zheng, Dr. Mimi Zhe, Dr. Eliza Wong, Dr. Justina Liu in the team. And we have experts from the Sweetquina International Center for Infection Control, Dr. Simon Lam, and Dr. Doris Leung, responsible for the statistics, and our PhD student, Mr. Terence Lau. The aim of the study is to develop and test a blended gaming COVID-19 training system, BGCTS. This system is tailor-made for training infection control practices, in particular for the staff who are working in the residential care homes. We developed this system by taking reference to the WHO guideline, the COVID-19 Risk Communication Package for Healthcare Facilities. This guidelines was first issued in March 2021, and the second version was released in July 2021. Other than referring to this guideline, we also take reference to the guidelines issued by the Center for Health Protection in Hong Kong. So the package was made in a way that we try to keep in line with the WHO guidelines as well as the local recommendations. So we have just make up this system. We want to test about whether this system is acceptable to the local practitioners. So we have conducted quantitative interviews with 6 residential care home staff. They are at different ranks. To conduct the quantitative interviews, we asked every participant to go through the BGCTS step by step without a lot of guidance to them, because the system is supposed to be automatic and they should give clear instructions to the users. So we use a video recording to observe what happened to the residential care staff when they play this system and how they respond to the instructions. So when they are playing the games in the system, the participants can talk about their comments and make exclamations and even make suggestions to us as well. At the end of the trial of the whole system, we asked the participants to give us the general impression of the system and tell us how good the learning process is. Do they like the flow of the learning, and whether the instructions are clear enough. So by now we have developed a system with an introductory animation chapter and 8 gamified chapters. Gamified chapters means that the chapters are full of games, but with the games, we have given very clear instructions and give a very clear, important message about infection control as well. So this BGCTS version 1, the users basically comment that this is very informative, and they have the system is highly motivating them to learn about the infection control practice guidelines, and they like the animations. In particular, they feel that the settings, the conversations, the tone are very much alike with the current practice, and they like the games, and they found the games are very useful and interesting and educational. But some comments we receive about the instructions. Some people comment that the instructions in some parts are not very clear. For example, in the 5 moments of hand hygiene, they don't know how to work with the system. So they would like to suggest us to add in more instructions at the very beginning. And some participants actually comments that some of the items can be relocated to other chapters. So we will value their comments. We will revise the system according to their comments. For example, we will change some of the graphics and instructions and some of the formats as well. So we are happy to see that the system is welcomed by the staff in residential care homes, no matter what rank they are from and what levels of health literacy that they have. And so the next step is that we will test out the efficacy of the system using a cluster randomized control trial, and we will start this trial very soon. So I would like to take this opportunity to thank Ms. Miranda Ng and her staff from Grace Healthcare Limited to support the development and testing of the version 1. And we would like to thank the Health and Medical Research Fund as well to support this innovative project. Thank you.